Yes. Now, last we will revise what we have studied, and let me tell you about the classification of ADRs, and let me make my statement very clear and very within these 2 slides we'll understand whole things. Now, classification of ADRs are classified. I'm not going to classify again excessive or the idiosyncrasy and the secondary pharmacological effects. This is the traditional way of classification what we have done, but in 2 slides we'll be understanding whole process. So ADRs are classified into different formats. The first one what we have studied, that is Rawlins and Thompson's in 1977. That classification is said to be as traditional classification. What we have studied is traditional classification of classifying adverse drug reactions, which is given by the Rawlins and Thompson's. So in this type of classification, the ADRs were divided into 2 groups mainly. One is the type A, Augmented, and type B, Bizarre. Augmented, in the simple terms, it is the known predictable effects, and Bizarre is unknown, unintended, and it cannot be predicted. It is unpredictable in nature. So this is the diagram I want to show. Now this slide will tell you all the things what we have studied. Coming to the criteria, we can see on the left hand side, type A and type B. As I told you, ADRs can be classified into 2 categories. One is type A, Augmented, and type B is Bizarre in nature. Pharmacologically, type A reactions are predictable in nature, and type B reactions are not predictable in nature. These are predictable and these are not predictable in nature. Dose dependent. Mainly the type A reactions, adverse drug reactions, are dose dependent, whereas type B adverse drug reactions are not dose dependent. Okay. Example of type A adverse drug reactions, which includes insulin induced hypoglycemia. Insulin is inducing hypoglycemia in the patients who are taking insulin therapy, a diabetic patients. Okay, he is put on into the insulin. As the dose is increased, the hypoglycemic effects are seen in the patients. So that is the type A adverse drug reactions, which is dose dependent, as I said. And type B adverse drug reactions, it is unpredictable in nature. We can see the penicillin induced hypersensitivity reactions. Penicillin is inducing hypersensitivity reactions. Okay, which is unknown. So they may test the dose of the penicillin by giving the test dose. Okay, whether the patient is sensitive to the penicillin or not. So it is very rare, and it is uncommon, and it is unpredictable. And some of the deaths may take place in the hospital because of the penicillin induced hypersensitivity reactions, anaphylactic reactions. Now, the incidence rate, the number of new cases, is very high in type A. So more commonly we can see the type A adverse drug reactions. The incidence rate is very low in nature. Coming to the type B adverse drug reactions, morbidity, which includes the permanent harmful effects, is low in type A, and it is high in type B adverse drug reactions. Mortality rate, which is said to be death rate. Death rate is low in type A, and it is very high in type B. Death rate is very high. As I told you, insulin-induced, the penicillin-induced hypersensitivity reactions, and some of the reactions may be life-threatening. So death rate is very high and death rate is very low in type A. Coming to the management part, last one is management. Dose adjustment is required. Dose adjustment is, we can just adjust the dose to stop the reactions because it is dose dependent, isn't it? It is dose dependent. And here we have to stop the therapy. We don't know the consequences of the therapy. So we have to stop the therapy totally because of fatal reactions which can cause injury to the patient and it may cause very life-threatening serious complications in the patients. So we have to stop the therapy, not to take the risk, and we have to stop the therapy immediately. Finally, this slide will tell you about all the classification of ADRs. So the ADRs can be classified into excessive pharmacological effects. And excessive pharmacological effects are those where frequently exposed to a drug for longer period of time. Okay, they are frequently exposed to the drug, the same drug for long period. That may result in excessive pharmacological effects. And second one, what we have studied is secondary pharmacological effects. And secondary pharmacological effects are those are said to be as type A, which is predictable, where the reactions can be predicted based on the pharmacological property. We can predict the reactions. Those reactions are called to be as type A adverse drug reactions, which is from the secondary pharmacological effects. Okay? So I told you the example of the bronchospasm which is caused because of the propranolol due to undesirable effect of blocking the beta-2 receptors. It can cause the bronchospasm. Okay? And the bradycardia we have seen that may be the primary pharmacological adverse effects of the propranolol therapy. So we have defined and we have illustrated with examples. And lastly, the last but one is idiosyncrasy. Idiosyncrasy, again, it is type B adverse drug reactions, which is non-predictable in nature. These reactions are producing bizarre effects, unknown effects, rare type of reactions, unknown reactions, which is said to be unpredictable in nature, non-predictable in nature. So idiosyncrasy, I have classified idiosyncrasy and I have told you they are coming under the category of type B adverse drug reactions, isn't it? So we cannot come to know the effects produced by we cannot explain it. It cannot be explained or cannot be predicted in an individual patients. Okay, it can occur because of genetically abnormal subjects, as we have said, or already prior drugs exposure is required for this patient to suffer from idiosyncratic reactions. Next one is allergic drug reactions. Allergic drug reactions, we have seen type B, it comes under the category of type B, unpredictable in nature, and it is not dose dependent. Okay, type B. We can see this is type A, idiosyncrasy and allergic drug reactions are type B in nature. Okay, both are type B, which is not dose dependent and it is unpredictable in nature. And coming to the examples of type B adverse drug reactions under allergic drug reactions, we have seen all types of hypersensitivity reactions like type 1, type 2, type 3, type 4 and type 5. Okay,